Good morning. I'm Kalili Bien, and I will be the moderator for today's media availability. To start, Austin Public Health Director Stephanie Hayden will first say a few words, followed by Dr. Jason Pickett, Austin Travis County Alternate Health Authority, who is filling in for Dr. Mark Escott today, then Austin Public Health's Chief Epidemiologist Janet Pichette. And then we'll open it up to the pool reporter who will ask questions from the media. Stephanie, over to you.
Good morning. Thank you very much. I wanted to start today to talk about COVID 19 deaths. In Travis County, we have 179 deaths. What is very concerning to me as the health director is that these are individuals. These are individuals that have experienced, whether it was being at home or being hospitalized, they have gone through this as well as their families. We want to always keep in mind that during this process, there is a notification process that happens to the family, but our staff have to follow up with them to talk with them about contact tracing. I would like to take a few minutes to just really pause and pay respects to the individuals of Austin Travis County that have lost their lives. Let's take a few moments of silence. Thank you. Thank you for that opportunity. We want to talk about personal responsibility today. As you are making plans to cover the essential needs of your household, whether you're an individual or a family, no matter how large or small, working and making sure that you are taking personal responsibility for your actions. But also, if you are a parent or caregiver, making sure that you are also being an influence, a positive influence. As we look at this response of COVID 19, Austin Public Health and all of the city and county and all of the hospital staff and everyone that is working in this space, we need you to help us and take that personal responsibility. We are looking forward for you to be an ambassador. And we may not ever hear about what you've done in the community for your family, but just know it is going to help us to flatten the curve. We have stood up some community testing sites because it is important for us to have facilities where we are able to test in the community 3 days per week. At this time, I will turn it over to Dr. Jason Pickett.
Director Hayden, thank you very much. And to echo what you've said here, it is the individual action by each person that helps to save lives and prevent the spread of this virus. It is not the testing or the contact tracing or the case investigation, but it is what we as individuals do to prevent the spread by wearing masks in public, by staying away from large groups of people, by washing our hands, by social distancing. It's those things that each and every one of us does every day that helps to slow the spread of this virus. We have a little glimmer of hope in this week's numbers where we've seen a slight leveling off of the hospitalization numbers. Where we were on a rapid increase, we've seen that plateau slightly just over the last few days. It is difficult to say if that is going to remain or if we are going to continue on this upward trend. The hospitals right now are stretched and they are pulling staff in from hospitals in other areas and contract staffing to increase their capabilities. But right now, the hospitals are stretched with patients and looking for help from the state and from their other hospitals as well. We too are requesting those resources from the state on behalf of the hospitals, and we are also standing up our alternate care site, our field hospital, if you will, to help take some of that burden from the hospitals to help them to care for more patients, especially those who are critically ill. But I want to say that this leveling off is very early right now for us to tell if this is going to be a trend or if we're going to continue on the upward trend that we have been seeing over the past couple of weeks. We have looked at and now enacted an additional order as it relates to schools. And we have ordered that we not have in-person classes until at least September the 8th, and that includes athletics. And this is to protect our children and also to protect our teachers. As we've seen from other areas that have opened schools early while there's still transmission, active transmission within their communities, when you look at South Korea, when you look at Israel, then opening too early led to substantial increase in cases, and they had to dial things back again. We don't want to make that same mistake here in Austin. We want to learn from the experiences of others so that when we do open up, that we do not end up with another surge of cases, so we do not have to close back down again. With that, I would like to turn it over to Chief Epidemiologist Janet Pichette.
Hey, Janet, we're unfortunately unable to hear you. If you don't mind, can we...
Can you hear me now?
Yeah, thank you so much.
Okay, sorry. It looks like it's off, but I don't know why it does that. So I would just like to add that we are at a point right now where we are going to surpass 16,000 new cases today. And we are at a point in this response where we continue to receive an overwhelming number of cases new cases on a daily basis. And we have widespread community transmission. What that means is that our activities related to contact tracing are going to be very limited in what they can do. And it again just reemphasizes the point that we are at a point in order to flatten the curve, we will require everyone to follow the orders that our governor and our local officials have put into place as far as wearing masks and protecting your family. If you did get a test, you need to stay at home until you get your test results back. Because if there's a possibility that we are seeing longer times as far as the time from when you receive the test until the time you get your result back, that there may be an issue. You may have an opportunity to be out in the community, and if that's the case, you need to probably stay home. So again, we are in what I would call a pandemic response, and it's going to require it's going to impact not just Austin, Travis County, as you see, it's impacting all the metropolitan areas in Texas, as well as a lot of the southeastern United States, having overwhelming increases in the number of cases. And in order to get a handle on this is going to require everyone's cooperation and individual responsibility to prevent transmission.
All right, thank you for those opening remarks. Now to our pool reporter, Molly Oak from KVUE.
Hey, good morning, guys. Thanks for always doing that. I know we all appreciate the updates. First one is from KVUE. APH has previously said hospital capacity isn't a concern yet, but you were worried about the rate at which patients were being admitted and that we could get into a more dire situation. What's your assessment now of how we're doing on hospital capacity and especially ICU capacity?
Thank you very much for that question, and I'll take that. We are right now, the hospitals are stretched. They're needing to find additional staffing, and they are finding ways to care for more patients within the hospital based on the limited or with the limited number of staff that they have. Right now we are competing for resources for those hospital staff from many other areas. And so this is the true definition of a national or global pandemic, and that the resources are stretched thin everywhere. We continue to make those requests, but right now those hospital beds are edging towards the maximum number that can be staffed and patients that can be taken care of. This is why we, a few weeks ago, decided to push forward with opening our alternate care site to help to take the burden off of the hospitals.
Okay, great. Thank you. Next question is from KXAN. How is the newest construction order different than the one before? Are you still doing targeted testing for those workers, and are those clusters getting bigger or smaller?
Currently, with the new order, we are really giving specific information about the screening of employees, as well as ensuring the social distancing, cleaning the tools, but also making sure that if individuals are testing positive or have any symptoms, making sure that they are not working. We are continuing to test and do that targeted testing in the construction industry as well. We are continuing to monitor those numbers as well, and so we're seeing a reduction in our numbers. But what we want to make sure is that the message is getting out to individuals that if they go to work and it is fine for them to be tested. We don't want them to just feel obligated to go into work and they know that they're not feeling well, or they may have a family member that's home that is COVID positive. So we want them to be able to isolate as well with their families. So we will continue to do that targeted testing with our community partners, and then also encourage essential workers to go to our community testing sites as well.
And next question is from Community Impact News. How involved were local school districts in the decision-making process to require virtual learning only until September 8th? Can you give us a sense of how often APH met with superintendents leading up to the decision and how those discussions went?
We have met with the superintendents throughout this process. We have a few superintendents that sit on what I'll call our policy group. And so we have been meeting with them since the inception of this COVID-19 response. Dr. Escott held a meeting just recently. He does meet with them monthly, but he also held a meeting with them on Monday to talk about and get their perspective, things that they were working on. So it's important for us to know that this is a collaborative process. We will provide to them our public health expertise, but because they are school officials, we are depending on them and work with the information and guidance that's been provided from TEA, but we are ultimately depending on them to implement those practices.
Yes, we've had representation from the school districts on our policy calls, as Director Hayden said. That policy board meets several times a week. So from the very beginning of this response, they have been there at the table with us, with the city leaders, with hospital leadership, in helping us to craft this response.
All right, next question is from CBS Austin. If we're running short on staff at hospitals, how will staffing not also be limited at the Austin Convention Center as an alternate site? Will the alternate site also drain resources?
We are competing for resources like not only our healthcare systems locally, but also healthcare systems in other areas. We are asking for resources from the state as well as from other states. We want to make sure that we're good neighbors, that the hospitals have adequate staff, that we are not taking resources from them to staff the alternate care sites, but it is a challenge. And I think that we are seeing challenges in the types of staff that we can source for those different environments. But we are in constant contact with the hospital systems, understanding their needs, and we want to make sure that we're not stepping on those requests, but in fact advocating for those requests from the hospitals to augment their staff.
And next question is from KUT. Austin had the highest COVID positivity rate in the country 2 weeks ago. Can you update us on the positivity rate now?
The best source of information regarding our local positivity rates will be from the Department of State Health Services. And the reason for that is because we have so many entities out in the community that are doing testing at the current time. It's hard for us to determine how many people have actually been tested in our community. We can calculate our positivity rate based on our specific testing, but we can't for other entities because we don't know the number of negatives that they've had reported back to them. So I would go to the Department of State Health Services for that information.
Next one's from the Statesman. Have any fines or penalties been levied for people or businesses that have violated local orders yet, other than those given by TABC? Why should people think new penalties will be enforced when they haven't been before?
The orders were recently passed last week at our council work session to put those in place. In addition to that, yesterday, the orders were posted yesterday. Prior to the orders being posted yesterday, internally, our staff met with city staff from across the city of Austin that work in enforcement areas, as well as our staff have met with the county staff. We are going to, as you know, a lot of the complaints are driven by the public. So when individuals will call 311 to report that in for compliance, we will have the ability to go to locations where we receive those reports, and we will be able to. Initially, our goal is to get voluntary compliance. That is our hope with everyone. And so we start at that place of voluntary compliance and work with them about how to implement those changes. In the event things are not implemented, we will move forward and provide a citation to them and take those individuals to court. So the process has been in place, and we have the approval from our city council to move forward in that space.
And next question is from Co-op Radio. For more than a week, we watched the dashboard data indicate that we were in stage 5, yet there was no announcement. Yesterday evening, Dr. Escott declared schools could not open as usual based on data. What data? Is this the same data supporting the dashboard?
The data that Dr. Escott is referring to is that, you know, that we monitor data on a daily basis. We look at the data from the number of individuals positive, our positivity rate. We look at the number of individuals that are in the hospital, that are in ICU beds. And so this is a collaborative process. When we look at this particular zone, it's from cases from 70 to 123. And so as we meet with our health authority, as well as our individuals that are providing healthcare in our community and our elected officials, collaboratively, we make a decision about when to transition to the next level based upon every individual's data, as well as the modeling that has been provided.
To add to what Director Hayden said, there are several factors that contribute to where we assess our stage to be currently. The running new hospitalizations, that 70 number, is one of those factors. But there are other things such as the rate of change, as well as hospital bed status, that help to contribute to when we believe that we're moving from one stage to another.
Next question is from Estonia. Are you expecting deaths to increase because of the recent surge, or are they leveling out?
The data that we have currently with regards to deaths shows a recent significant increase in excess deaths, 23% above what is the expected number of deaths for this time of year. So with the recent surge in cases, we do expect to see a surge in deaths at the same time.
Next question is from Univision. With the new school year around the corner, many school districts are already deciding to go 100% with virtual classes for the first 3 weeks of the school year. How bad does the situation have to be in order for you guys to recommend doing virtual classes for the rest of the school year?
It's difficult for us to model beyond just a couple of weeks from now because individual behavior influences the spread of the virus within the community. How people are adhering to the social distancing and the masking. And this is something that we model week after week to see where we might be a little bit of time from now, a few weeks from now. But unfortunately, our ability to see into that future is very limited. It's really only accurate within a couple of weeks, a few weeks from right now. So we evaluate this on an ongoing basis to see what the disease is doing in the community, how our cases are rising or plateauing or falling off to make recommendations for policy. So unfortunately, we just can't say what things will be like in October because we just don't know.
Next question is from Austin Business Journal. Have there been any new indications on the rate of transmission over the past week?
Am I on? Okay, I guess I'll answer that. I mean, the rate of transmission, obviously our case counts continue to increase. So I would venture to guess our rate of transmission is also increasing. Again, I think when we start seeing that the epidemiologic curve starting to flatten again, will show that transmission is reducing. That's why we are, asking every community member to be sure to make sure they're following orders as far as wearing their mask, social distancing, and practicing those prevention and hygiene activities to reduce transmission. Ideally, we would like to squash and flatten the curve where we can, and those are the activities that are going to make that happen.
To add to what Janet is saying, we're hamstrung somewhat by the increase in turnaround time of the test results that we are getting. All of the labs in Texas are also stretched and overwhelmed, and so our test turnaround time, the amount of time it takes from obtaining the test to getting the result, has increased drastically. Because of that delay, then it's difficult for us to say where we are yesterday with regard to the test results in the community and the new cases within the community.
Yeah, and again, that's why it's so important for individuals who are tested, because there could be a lag of 5 to 7 to 10 days to get your test results back if you are tested. We're asking people who have been tested to remain home until they get their test results back, so they're not actively transmitting disease should they have it and not be aware of it.
Box 7 is asking, what will a 3-week delay in opening schools actually get us?
It gives them more time. It gives them more time to prepare. and to develop their plans and put in place their methods for mitigating the spread of the disease. TEA and the CDC have come up with some great recommendations with regard to how to distance within schools and spreading out the desks, wearing the masks, uncrowding the hallways so that kids can be farther apart. These are all great suggestions, but we do not have them in place right now. And we cannot increase the physical footprint of the schools overnight. So it gives the schools the time to work on those plans, to continue to develop them, and to work with Austin Public Health in recommendations of how we can better keep our kids as well as our teachers and staff safe.
This one's from Austin Politics Newsletter. Yesterday, Dr. Escott said that between 40 to 1,300 AISD students could die from COVID if schools reopen. But what numbers suggest that is realistic? The CDC reported on July 4th that of the first 100,000 COVID-19 deaths, only 179 were below the age of 25. The entire state of California still hasn't had a COVID-19 death below age 18.
So we are in, locally, we've not had any deaths in children from this disease. So we have to go with data that we get from other areas that have been harder hit, places like China. So what we see is that the death rate for children or for those under the age of 19 is very low. But once you multiply those low numbers by the nearly 200,000 students that we have in Austin Travis County, then now you start to see a much larger increase. So from data from China, we estimate that the death rate in that age group is somewhere around 0.18%. That death rate may range from 0.03% to 1.02%. But again, once you multiply that by the numbers of students that we have, and if we assume, as we should, that not having any natural immunity to this virus, that 70% of our population is going to get this virus, then now we start to see those deaths stack up. And that's where those numbers come from.
Okay, and then this last question is from KView. What is the status of the field hospital? Will that still be used? And if so, at what point would it start accepting patients?
Our planned go live date for that hospital is July the 21st. So next Tuesday, I think. And when they start taking patients, that's largely up to the hospitals when they feel they can start, they need to start offloading patients. The emphasis with the alternate care site is that we're taking care of patients with lower acuity disease, what would be referred to as med-surg level acuity. So that's like your garden variety hospital bed level acuity. We're not planning to run an ICU in the convention center. We don't think that that's practical, and folks who are critically ill that need that level of care are best served in the hospitals where the quality of that care will be the best. So it's, as I mentioned before, the hospitalization numbers have leveled off for the past few days. So I don't know if we're going to take patients from the hospitals on day one of the alternate care site being open, but I know that we will be ready to do so.
Right, that wraps our media question portion of the media availability. Before we wrap, would you all like to give any closing remarks? Let's start with you, Janet.
I would like to start with just a reminder about personal responsibility. My call today is a call for action. As an individual, I would like for you to think about what 3 things that I could do to make things better for my community when I'm thinking about COVID-19. As you're thinking about that personal responsibility, those individual things you can do, one is please try to limit going from your home. We understand that, we have individuals that must leave their homes to go to work. We have individuals that, may need to go out to grocery shop. But if you are in a position where you don't have to leave your home, then we will request that you limit going to places. We also request that you also be that person, be someone's North Star, where someone can say, you know, my friend has really taken upon themselves to be this unsung hero in our community. And these are some of the things that they are doing. And maybe those things will continue to be to rub off on other individuals. We want to encourage individuals to come to our community testing sites. We have a site at Dove Springs, as well as Brunberg Community at Walnut Creek and at Givens Park. We are there 3 days per week, and you can go through our testing site and sign up for that testing. If you don't have access to the internet, we still encourage you to call our nursing line and talk with them, and we will definitely get you scheduled. We thank you for the things that you have done, because we do have people in our community that are really doing some awesome things. They are checking on other people. They are making sure that other people's basic needs are met by providing food, etc. And so we applaud you, our heroes in our community. Thank you very much. I'll turn over to Dr. Jason Pickett.
Thank you, Director Hayden. Very wise words there. It is on all of us to stop this virus, to slow its spread and protect our most vulnerable people. Now, we do not yet have a vaccine for this, and I do not know when that might occur. There are a lot of folks who are working very hard to develop one that will be safe and will be effective. But until that happens, this virus can run through our community, and we will not see herd immunity until about 70% of our community has developed immunity, either through getting the virus or through a safe vaccine. And this is why all of these actions that we are taking are so important to prevent that spread, because we don't have another way to prevent that spread right now. We have this alternate care site that's being stood up. I hope that we don't have to take a single patient in it. I hope that the disease levels off, that the hospitals are able to care for everyone that needs to be cared for in that hospital setting. But we got to be ready for it, and we will be ready. So I'm optimistic. You never want to work very hard on a large project and then never use it, but I hope we never have to use this one. And to echo what Director Hayden said, thank you so much for what you are doing to help slow this down. We saw early on when we had the shelter, the stay-at-home orders, the stay home, stay safe, and stay home, work safe orders. We saw us flatten that curve. We saw that what we do works by staying home, by staying away from other people. And that was because of what you have done to help in this effort. So it's a long effort. Please keep at it, and please help your friends, your neighbors, your family by slowing this spread.
Thank you. I'd just like to remind everybody, the public health workforce has been at this fight since January. Early on, we were monitoring people who were returning from countries that had COVID and had them quarantined, and we're monitoring them twice a day. It then became our fight to begin trying to control the spread of disease in those people who actually developed illness. I just want to remind everybody, this is not just our fight, this is the community's fight. And we are at a point now where we need to come together as a community and fight and flatten the curve once again. As Dr. Pickett said, you know, we were doing well during the shelter in place order. And I think we can get back there if everybody fights together. So I appreciate everybody's efforts, and wearing their masks, staying home if they're sick, and trying to minimize the spread of the transmission related to this illness. Thank you.
Thank you, everyone. That concludes our media availability for today. Thank you to APH Director Stephanie Hayden, Dr. Jason Pickett Dr. Jason Pickett for filling in, epidemiologist Janet Pichette, and the poll reporter for joining us today. Thank you, everyone.